Good morning, everyone. So, in today's lecture, we are going to discuss about the assessment of the severely malnourished child, part 4. So, in the last lectures of protein, energy, malnutrition, we had already discussed about the undernutrition, then overnutrition, then the indicators of undernutrition. Then we had discussed about the pathological changes in malnutrition in various organ systems. Then the etiological factors contributing towards protein energy malnutrition. Then we had discussed about the clinical features of malnutrition, that is mild malnutrition and moderate and severe malnutrition. In that we had discussed about the marasmus, then kwashiorkor, their clinical features. Then we had discussed about the marasmic kwashiorkor. So this was all about the last lectures. Now in today's lecture, we will discuss about the how can we assess a severely malnourished child. So basically the anthropometric measures such as the weight for the age, height for the age, weight for height and body mass index for the age and SD score. SD score that we had discussed in the definition of protein energy malnutrition, that is the Z scores. So basically these anthropometric measures, they are used for the identification of the malnutrition. And malnutrition can be acute and chronic. Then we had discussed in definition also that according to WHO and UNICEF, weight for height, if weight for height is below -3 SD or Z score, then it comes under category of severe acute malnutrition. Then we had discussed about the various indicators of undernutrition, that is stunting, low height for age, wasting, low weight for height, underweight, low weight for age. So today we will discuss how can we assess a case of severely malnourished child. So let's start our topic, part 4, assessment of the severely malnourished child. So first step is history taking. The child with severe malnutrition has a complex backdrop with dietary, infective, social and economic factors underlying the malnutrition. Then a history of events leading to the child's admission should be obtained. We should take a detailed history of entire events, of all the events which leads to the child's admission. Then socioeconomic history, family circumstances should also be obtained. They should also be explored to understand the basic cause of malnutrition. Means detailed history of the socioeconomic status, then the family status, the circumstances of the family members. They should be explored. They should be obtained so that we can understand the basic cause of malnutrition. We are able to explore the basic underlying cause of the malnutrition. For that, detailed socioeconomic history and family history must be obtained. Then special attention should be given to the usual diet. Means particular special attention should be given towards the diet of the child, the usual diet of the child which he was taking before the current illness. And this history could be obtained from the parents, especially from the mother, that what was the usual diet of the baby before the current illness, and including breastfeeding. What was the status of the breastfeeding before the current illness? Then detailed history should be obtained regarding presence of the diarrhea. That should include the duration of the diarrhea, frequency, then the consistency of the stool, whether it is watery or it is containing any blood or mucus. So detailed history of the character of the diarrhea, presence of the diarrhea, which should include the duration of the diarrhea, the frequency of the stool, number of stools the child is passing, the consistency, watery, or the stool is having any blood or mucus. So presence of diarrhea. Then information on the vomiting. Detailed history should be taken regarding loss of appetite, presence of cough, or whether there's any history of vomiting. Then history of contact with the tuberculosis. Now malnutrition may be the presentation of HIV infection also. So Detailed history is very important in the assessment of a severely malnourished child. So this was all about the history. Now examination. Now this include anthropometry, which provides the main assessment of severity of the malnutrition. Initially we took the history, then examination. It includes anthropometry, which provides the main assessment for the severity of the malnutrition. So physical features of the malnutrition, they are described and they should also be looked for. So physical features of malnutrition should be looked for. Then clinical features of the prognostic significance include signs of dehydration, then signs of shock, for example, cold hands, slow capillary refill, weak pulse, rapid pulse, then severe palmar pallor, paleness over the palms, then eye signs of vitamin A deficiency, then localizing signs of any infections, then skin infections or pneumonia or signs of HIV infection, then if fever is present, temperature more than 99 °F, then hypothermia. In hypothermia, rectal temperature should be less than 35.5 °C. Then mouth ulcers, cracks around the mouth, skin changes of Kwashiorkor. So these are the clinical features of prognostic significance. That is signs of dehydration, signs of shock, palmar pallor, signs of vitamin A deficiency, then signs of any skin infections, HIV infection, fever, hypothermia, signs of Kwashiorkor, skin changes of Kwashiorkor, and localizing signs of infections. So this is the assessment of the severely malnourished child. And physical features of malnutrition, that means the physical features of malnutrition that we had discussed in the marasmus, kwashiorkor and mild malnutrition, we should also look for those features. So firstly history, then examination, that is anthropometry, weight for height, height for age, BMI. Then third, physical features of malnutrition, which we had discussed in the last lectures, they should be looked for. And then lastly, clinical features of the prognostic significance. So this was all about the assessment of the severely malnourished child. Thank you.